Now, during the winter, our health can suffer, but for the homeless, accessing medical services can be a huge challenge.
Well, in Somerset, a team of doctors and nurses has been set up to help bring help to those living on the streets in hostels and other temporary accommodation. Victoria Davis went to find out more.
Hi, Peter, do you want to come back through? Thanks for coming back. All right, come on down.
At this hostel in Taunton, Peter is getting vital medical attention. He's been homeless for 10 years and has diabetes. But thanks to Somerset's Homeless Health Service, he's able to see a doctor or nurse twice a week at this drop-in clinic.
4 units, brilliant. Okay. Are you feeling all right?
Feel better,
okay.
yeah.
Okay, all right. He's had another spell in hospital with really high blood sugars, which is really life-threatening. And so we kind of wanted to sort of like touch base with Peter when he came out of hospital.
I've got problems with my eyes. I lost a toe over it, and I've got cardiovascular disease in my legs. And then when I get these diabetic episodes, it accelerates all of the problems.
So how vital is this service to you?
Yeah, I wouldn't be here if it wasn't for this.
The homeless can struggle to access basic healthcare. This means, on average, they're only expected to live until their mid-40s. But Somerset is leading the way to change that. It has a specialist outreach service run by the council and NHS to give the homeless the help they need before it becomes a medical emergency.
A lot of the conditions we see are, at the moment in the winter, it's lots of chest problems, respiratory problems, and we're seeing lots of wound care issues as well. We treat wherever's needed, basically. So be that, on the street or in a shop doorway or wherever the client is, that's where we treat them. And I think just because their life situation has brought them to where they are now, it doesn't mean they don't deserve the same health care as anybody else.
Chris is a regular visitor to the drop-in clinic at Lindley House Hostel, and for him, the treatment he receives is essential.
Really nice ladies, like, really lovely and helpful. And just see them twice a week and they help me basically all the time, yeah. So you've got to be lost about it, to be honest, yeah.
It's a bit of a lifesaver.
Yeah, man. Cool.
So one of the reasons that the Homeless and Rough Sleeper nursing service was set up was because a lot of homeless people were needing to go to A&E because it was the only place that they could get support and help. Really, this service came out of realising it's much better if a service goes and actively looks for people and actively welcomes them rather than putting up barriers.
The outreach service not only provides medical treatment, but can also offer help with mental health issues, as well as support for drug and alcohol misuse.
I'm really proud of what we've achieved in Somerset. It's taken about 4 or 5 years to reframe how we see homelessness. So for a long time, nationally, homelessness has been seen as a housing issue. I think we've demonstrated it's a health and well-being concern for the whole county. So I think to have reached the point where we are gives us a really good foundation to look after people going forward.
And for Peter, that help he receives is a lifeline. Victoria Davis, ITV News, Taunton.